So good morning, everyone, and I'm very happy to be here today to share with you the findings from the ManCount survey and to represent the study team in sharing these findings back to you. As you can see by the logos, this is definitely a collaboration between different agencies, and what I've tried to sort of capture the contributions of everyone who's been involved in the survey at any point in time, and it certainly involves many of the people here in the room today, and certainly I'm very grateful for the contributions that everyone has made to this survey. And what we haven't sort of listed here as well are all of the community agencies and local venues that allowed us to come into onto the premises to deliver the survey, so also very grateful to them. So just to tell you a bit about ManCount, and I think some of you may have know quite a bit about ManCount. We did present some of the findings from ManCount at the summit last year, but here today we're presenting the main survey findings from the main survey. And really, ManCount was a sexual health survey for gay, bisexual, and other men who have sex with men in Vancouver. And really, the vision when we got together initially to plan the survey was to collect relevant data to inform our collective action to prevent the transmission of HIV and to improve the sexual health of gay men in Vancouver. But our very specific objectives were to measure the prevalence of HIV, hepatitis C, and syphilis, and to track trends in testing and sexual behaviors. So I think it's important to acknowledge that this is a kind of survey that I think Tracy Healy used the analogy this morning of the iceberg, and really this is just looking at the tip of the iceberg. It's looking at what are the trends in HIV and the impact on the population, and it's not a survey that really tries to get at some of the determinants or the role of determinants on HIV. And so I think of it like a snapshot at a point in time of what's going on with HIV in the population, and if we repeat it again in the future, it'll give us a way of tracking these indicators and how they've changed over time. So ManCount is the Vancouver site of MTRAC, and MTRAC is a national HIV surveillance system for men who have sex with men across Canada, and it's been delivered at these various cities across Canada, and it's funded and coordinated by the Public Health Agency of Canada. Before getting into the study findings, I think it's important to just remind ourselves that gay, bisexual, and other men who have sex with men are the population most affected by HIV in the province of British Columbia. And certainly what we've seen in terms of the number of new positive HIV tests every year amongst men who have sex with men is that the number remains at a high and steady rate every year in comparison to some other populations where we have seen some recent decreases. The Public Health Agency of Canada provides us with some estimates of the number of new infections and the number of people living with HIV, and certainly we see again that men who have sex with men are about 50% of all of the people who have a new HIV infection every year. And comprise about 45%, according to this estimate, of all of the people living with HIV in the province of British Columbia. So clearly, and I don't think this is an argument I need to make very strongly here, HIV is a very important issue for gay men in British Columbia. So I won't spend too much time on the survey methods, but I'm happy to answer any questions about this later. But essentially, this was a community-based survey where survey staff went into a number of different kinds of community venues in Vancouver, and that included bars, events or festivals, associations, organizations. It's very hard to try to get a representative sample of gay men, but what we had done was we used an approach called time-space sampling, which is trying to at least be a bit random in terms of when you go into different venues to sample, to see if we could get a more representative sample. The survey was conducted between August 2008 and February 2009, and in these venues, men were eligible to participate if they were 19 years of age or older, if they self-identified as a man who has ever had sex with a man, and if they were able to complete a questionnaire that was in English language. Overall, we got a questionnaire was complete, and the questionnaire was a self-completed questionnaire. 1169 men completed a questionnaire, and at the end of the questionnaire, men were asked to provide us with a fingerstick blood specimen, which was used to prepare a dry blood spot, which was then tested for HIV, hepatitis C, and syphilis. And almost all men, 1139 men, gave us a dry blood spot specimen for analysis. And this was an anonymous survey. And we did provide an honorarium for participation in the study. A subset of men for a more limited period of time were also asked to provide a self-collected rectal swab to test for human papillomavirus, chlamydia, gonorrhea, and indicators of anal cancer. Before getting into the study findings, I think it's important just to note that the data and what we have here really can only be said to represent men who do go to the venues that we went to. We're certainly looking at some statistical methods where we can see how we might be able to adjust to try to get a more true population estimate, but essentially that's as much as you can say about the data. And if men who never go to any of these venues couldn't be captured in the survey and would not be represented in the data. And so for that and for other reasons, for example, I mean, this is a survey that's done in community venues, which is very different from doing a sort of controlled research in sort of a clinical environment. We need to remember that the results are estimates, and that they may vary, or probably vary, from what might be the true population results by a few percentage points. But part of the purpose or the intent behind ManCount is that it's a survey that could be repeated again in the future. And so really the point of this is that it provides reliable, although arguably imperfect, indicators on the road to a community response. So in the first section of the results, I'm just going to describe who were the men who participated in the survey. You can see that most of the men were recruited in bars in Vancouver, 54%, followed by 25% at events or festivals, 12% at local businesses, particularly Little Sisters Bookstore, 5% at various associations or organizations, and 4% of men were recruited in the bathhouse. The participation was pretty well distributed by age, with fairly even proportions amongst men who were between 19 and 30 and between 30 and 45, with slightly fewer men in the 45-year and older age group, but the median age was 33 years. When we look at it by self-identified sexual orientation, 81% of the men did identify as gay, so this is very much a gay men survey, with 11% of men identifying as bisexual, 3% two-spirited, 2% queer, and 2% straight. In the question that we asked about gender identity, about 95% of men identified as male, and 1.6% of men identified as being trans, either trans men or trans women. In terms of ethnicity, it's a predominantly European ethnicity or European descent. Population was 75%. The next most common ethnicities were Asian, and that includes sort of South and East Asian men at 7%, followed by Aboriginal at 4%. And then there were a number of other ethnicities or mixed ethnicities reported that made up the remaining 14%. We didn't try to exclude people based on where they lived, and we knew that we'd be capturing people from outside of Vancouver in the survey. And part of that was thinking that these are men who are in Vancouver and are part of the sexual landscape in Vancouver when they come to Vancouver. And certainly we did find, however, that 87% of men did live in Metro Vancouver, and many other men lived nearby, in nearby provinces or to the south in Washington or Portland, for example. But we did have the occasional person in the survey from far around the world. So that's a brief description of the participants, and now move into the next section, which is sort of describing the findings for HIV and for other infections. And I think probably many of you are aware of the statistic by now that the survey did show that the measured prevalence of HIV, and so that's not based on self-report, that's based on the measured dried blood spot, was 18.1%, or that 1 in 5 men approximately were positive by blood sample in the survey. And when we restrict the analysis just to men who lived in Metro Vancouver, the percentage was slightly higher. It was at 21% for men who lived in Metro Vancouver. So this certainly is very high, but I think there are a couple of points to keep in mind when you think about prevalence. One thing is that this is a finding that's quite similar to what you see in other surveys in large urban centres like Toronto, Montreal, New York, or London. So it's not necessarily unique in that sense. And it will take decades for prevalence to decrease with a decrease in incidence, because prevalence indicates people who are living with HIV, and in one respect as well, it's an indicator of success because people are living with HIV and are contributing to this prevalence estimate. We do see clearly that there's some differences by age group in terms of the experience of HIV. So we did look at the proportion of HIV or the prevalence of HIV in different age groups. And as you can see on the left, that of men who were 45 years of age and older, the HIV prevalence was 34%, or 1 in 3 men. And so that really does speak to, I guess, the probably greater common knowledge of HIV, people who have HIV or being HIV positive in this age group. Whereas if you look at the other extreme of men who are under 30, the prevalence of HIV HIV was 7% in this age group. So that also speaks to perhaps not necessarily knowing somebody who's HIV positive in your age cohort in that age group. I think for those of us who are aware of some of the work that's come out of Ron Stahl and his colleagues, where they've sort of have modeled sort of the expected prevalence over time in the gay community, where it's showing that over time, as gay men get older, that the prevalence does increase. And these findings do suggest that that's something that may be something that happens here as well. But it does then also support the idea that, you know, young men in particular, men under 30, may provide a population where there may be an opportunity to reverse some of those trends. For the people in the survey who identified as being HIV positive, many of the men here did have access to and reported using HIV medication. 71% of men in the past 6 months reported using HAART or anti-HIV meds, and it was slightly higher if you asked about ever. As I understand from colleagues at the Centre for Excellence, this is actually a fairly high statistic in comparison to some other populations in British Columbia. So because we asked men in a survey whether they were HIV positive, negative, or didn't know, and then we measured their dry blood spot, we could actually look at people who said that they were negative but actually had a positive dry blood spot. And so what we found that overall in the study population that this percentage was 2.5%, and that means that 1 in 40 men were unaware that they were HIV positive. And I think it's important, we often hear sort of the 30% statistic, to keep in mind that these are different statistics, where what we would also, this translate into 14% of men who had an HIV positive blood test not knowing that they were HIV positive. But that's 1 in 40 of the entire sample, and I think that's an important piece to keep in mind. We did ask men HIV negative men, what they thought was their likelihood of becoming infected with HIV in their lifetime. And we found that 13.6% of HIV negative men believed that they were somewhat to very likely to become HIV positive in their lifetime. Which when you actually, we haven't looked at this in great detail yet, but when you look a little bit at the data, certainly to one respect it does actually reflect reality, and it may be sort of a valid or an accurate sort of assessment of likelihood when you look at, for example, men who were unaware of their HIV status, or men who reported what we would consider to be riskier behaviors. It was more commonly reported that they felt that they're more likely to become HIV positive. But at the same time, again, it's difficult to know exactly how to interpret this, and perhaps this may also be related to a sense of fatalism or just a sense of inevitability. So we did test for a couple of other infections in the dry blood test, including hepatitis C and syphilis. And some of the differences here that are important to note is that the test for these antibodies indicate either current or past infection with these agents. And there's a little bit more uncertainty with these findings, both in terms of the nature of the lab tests that are used and how we estimate the proportion of unawareness. So there's more uncertainty, I think, with this than with the HIV data. But essentially what we did find is about 4.9% of men had antibodies to hepatitis C. So that means that they had either past infection or current infection with hepatitis C. And of these, 23% of men appeared to be unaware of their hepatitis C status. Many of these men, the majority of these men, did have a history of injection drug use, which we know is a well-established risk factor for infection. But there were men who did not, and many of these men were HIV positive, suggesting that there probably is sexual transmission of hepatitis C, as we've certainly been hearing from folks who work at the front lines in BC, as we have seen reports coming out of Europe in particular. For syphilis antibodies, 4.4% of men had antibodies to syphilis, again indicating that could be past or current infection with syphilis. And of these, about 31% appeared to be unaware that they had a history of syphilis. We did ask men about whether they'd ever been diagnosed with a number of different infections, and so this is self-reported data. But you can see that we asked about if they'd ever been diagnosed or if they'd been diagnosed in the past year. And certainly, I think what you can see is at least that the self-reported diagnoses of these various infections is high, ranging from 5% for gonorrhea down to about 1% for hepatitis A. And if we look just in particular at the first 5, gonorrhea, chlamydia, genital warts, syphilis, or genital herpes, about 11% of men reported that they had been diagnosed with one of those infections in the past year. So this is obviously important from a sexual health perspective. In terms of each of these infections, it's important to treat, and they have their own sort of complications or morbidity. It's also important in terms of HIV, because we know that sexually transmitted infections can both make someone more likely to acquire HIV if they have a sexually transmitted infection, and for men who are positive, they're more likely to transmit HIV if they have a sexually transmitted infection. So it's an important driver of HIV in our community. I won't go into the data from the self-collected rectal swabs in detail because we did talk about this a lot at the summit last year, but just as a reminder, 62% of men did have human papillomavirus infection on the rectal swab, and 42% of men had anal dysplasia, and that means sort of changes in the cells in the anal canal that could potentially be a precursor for anal cancer, which is related to HPV infection. We did test as well for chlamydia and gonorrhea, and so that meant that at that time we did the survey, 5% of men were infected with a rectal chlamydia infection and 2% with rectal gonorrhea. So the next section of the survey findings relates to testing practices, and that's obviously a very important part of prevention and HIV prevention programs for gay men. And so we did ask men about whether they had ever been tested or tested in the past year, and there's a number of things that we can point out with this slide. So the first is that for HIV men were more likely to report HIV testing compared to other infections, as you can see here, with 86% of men reporting testing for HIV versus between 65 to 70% for these other infections, with 51% reporting testing in the past year compared to about 30% for these other infections. The other point, which isn't made here, but for the ever testing variable, this is lower amongst younger men, which one might expect given that they're younger and have less of a chance to have a test in their lifetime. But again, it does speak to the importance of testing, particularly in younger men. I think the other point to keep in mind as well is that, not necessarily this includes everyone in the survey, including men, for example, who didn't have any sexual partners or who may be in a monogamous relationship. And so we wouldn't necessarily be expecting to see 100% necessarily for these values. We probed a little bit in the survey in terms of reasons for testing and not testing for HIV. And so these were asked of men who reported that they were HIV negative. And so for those who tested in the past 2 years, the main reason that men got tested was because it was a regular routine, with it being about 56% of men reporting that. With 10% of men reporting they got tested because they started a new relationship, and 8% of men reporting that they got tested because of some kind of risk event or potential exposure that led to them getting tested. It's not shown here, but about 7% of men reported a reason that was somehow related to some of sort of the community health or public health measures, things like seeing a promotional campaign for testing, or being encouraged to get an HIV test by a healthcare worker, or getting tested for HIV when they're getting tested for other sexually transmitted infections. The flip side then is we asked men who reported that they hadn't had an HIV test in the past 2 years what were their top reasons for not getting tested, and multiple answers were possible for this question. And the most common reason for not testing was perceived low risk. 59% of men perceiving they had low risk, and in fact when we did look at the survey data for these men, many men did appear to be at very low risk of HIV infection, and so in part this is true, although there's probably some misperceptions of risk included in here as well. 32% of men said they didn't test because they were consistently safe, but 30% of men said that they hadn't tested because they hadn't got around to it. And so that may speak to motivation to get testing, but it may also be a reflection perhaps of it may not be easy to get an HIV test necessarily for some people, and so it requires sort of an extra effort to get a test for HIV. We've not shown here, but about 16% of men, 16 or 17% of men reported that they didn't get an HIV test because of some kind of negative consequence of HIV, such as concern about the impact it would have on their sex life, worried about discrimination, the impact on their relationships, for example. When we went back and we looked at the men who were unaware that they were HIV positive, and it's a small number of men, but we did look at their testing patterns, and about 3/4 of the men did have a history of an HIV test ever, and about half had tested for HIV at least once over the past 2 years, and often more than once over the past 2 years. And what this said to us is that these may be men who may be sort of between their routine tests or between their screenings for HIV, and so we've caught them at that interval where they believe that they're negative, but they will get tested and be diagnosed with HIV. For those that hadn't tested recently, they were more likely to report some things like being concerned about the impact on their relationships, or some of the negative consequences for HIV. So there's clearly sort of different factors that are at play here, but certainly this finding to us suggests that any kinds of strategies that may help to increase the convenience of testing or increase the frequency of testing may help to improve the timeliness of diagnosis with HIV, which, as we all know, has significant benefits. So the fourth section then is just to focus a little bit on the information about sexual health and behavior from the survey. So the survey really did show a wide range of sexual behaviors, and it certainly speaks to the diversity of the population that we surveyed, ranging from men who had no partners to men who had over 50 partners in the past 6 months. 11% of our population reported they had sex with a woman in the past 6 months, for example. We also saw men who did or didn't have anal sex in the past 6 months, and a number of other things which we will share with the survey. I mean, one of the indicators that we follow in particular is looking at this statistic, the proportion of men who report having unprotected sex with a partner who had either an unknown HIV status or actually had a known but different HIV status, because those are clearly situations that probably are at a greater risk of HIV transmission. And 21% of all sexually active men in the survey did report this behavior over the past 6 months. We also asked, this has emerged out of some of the previous Sex Now surveys, around whether men experienced any feelings of pressure to have unprotected sex, and about 29% of men did. And while we don't really have any explanations for this in our survey data, certainly other work by the Community-Based Research Centre suggests that in part this may be due just to not having condoms available at the time, so supporting the need for condom distribution, but it may also speak to some social pressures or pressures within that sexual encounter to have unprotected sex. What's also clear to us from the survey is that gay men do take prevention seriously. And when we specifically asked men about whether they used any of the following risk reduction strategies, we didn't have a time interval on it, but just to see if these were strategies that men had used in the past. And when we asked questions of HIV negative and positive men, although some differences between them, but you can certainly see that men are taking measures to reduce their risk of infection. So 68% of all HIV negative men reported using condoms always as a strategy. And we did ask the entire survey population if they'd used a condom the last time they had sex, and 58% of men had said that they'd used a condom the last time they had sex. Roughly 63% of both HIV positive and negative men reported that they asked the HIV status of their partners, which can then lead to sort of more informed negotiations or informed decisions around sex. And for HIV positive men, 58% said that they would choose to have sex which didn't include anal sex as a potential strategy for risk reduction. Controlled ejaculation or withdrawal before ejaculation was common about 44 to 46% of men. And both HIV negative men and HIV positive men reported serosorting, or looking for a same status partner for unprotected sex. But this was a little bit more common amongst HIV positive men compared to HIV negative men. And about a third of all men reported strategic positioning, so choosing to be the top or the bottom. We found that not many men reported consideration of viral load as a factor in terms of thinking about reducing risk, but this was slightly more common amongst HIV positive men compared to HIV negative men. So I think that what this enforces for us is that gay men are engaging in a number of different kinds of strategies to reduce their risk, and evidence does show that these are strategies that do in fact reduce your risk, and so there's certainly a need not to try to change necessarily these behaviors, but to try to make sure that these behaviors are happening with the appropriate information and resources, for example. Now, there are times when these risk reduction strategies fail, and this was sort of alluded to in a comment in an earlier presentation this morning. When we went back and looked at the men who were unaware that they were HIV positive, so these were men who were more likely to report having unprotected sex with an unknown status or discordant status partner in the past 6 months, which may speak both to potentially how they became infected with HIV, but it then also, because these are men who think they're negative, it also, because they're continuing to engage in that behavior, they then may also facilitate transmission of HIV, particularly when one thinks that probably some of these men were in the acute stage of HIV infection, whereas we know there's very high viral loads and infectiousness is higher. But what we also found is that the majority of these men did report using serosorting as a strategy. And certainly this is an example of where serosorting fails. When men who believe that they're negative are using serosorting as a strategy or relying on that knowledge in their partner, when in fact they're HIV positive, is an occasion where that strategy does fail. We asked men about what were the settings in which they sought sex partners in the past 6 months, and the most common venues were gay bars, and then closely followed by the internet, with the baths being about almost a third of men. 20% of men reported events such as sex parties or circuit parties, and parks or other public spaces was an 18%. And there were some age differences here, not really so much in terms of seeking sex in the bar or on the internet, but certainly younger men were less likely to report going to the baths or using public spaces like parks for seeking sex partners. We did also look to see whether there was an association between these different kinds of venues and reporting risk sex or unprotected sex with people with unknown or discordant status. And we do see that some of these venues, in particular the baths on the internet and the gay bar, are associated with unprotected sex. We did ask about some other sex practices which may provide some risk for other kinds of infections. We found that 57% of men reported rimming in the past 6 months. 34% of men reported three-way or group sex in the past 6 months. A third of men reported douching before sex. 31% reported sex toys, and 4% of men reported fisting in the past 6 months. We asked about substance use in sort of around the time of sex, so kind of in the 2 hours before or after sex. And the most common substance used was alcohol at 77%, followed by marijuana, poppers, cocaine, Viagra, and crystal meth. In comparison to some of the Sex Now data that we've had here locally as well, this is sort of a higher percentage of men reporting cocaine and a lower percentage of men reporting crystal meth. And it may be differences in the population surveyed, but it may also represent changes over time in terms of drug use and patterns of drug use. We also did find that use of poppers, cocaine, and crystal meth was associated with unprotected sex with an unknown status or discordant status partner. So just to touch on some of the other health issues that we asked in the survey. So we did find that many men smoke. So 38% of men, and slightly higher percentage amongst younger men, are reported currently smoking. We found that between 64 to 73% of men reported that they've been vaccinated against hepatitis A and B, which are both vaccines which are free for men who have sex with men in British Columbia. We wonder if in part this may be related to our third finding. We asked men if they had ever disclosed to a healthcare provider that they had male sex partners. And 79% of men had disclosed that they had male sex partners to healthcare providers. So there's certainly a significant minority of men who reported that they had not done that. And what we did find when we looked at the men who had disclosed, that typically it was about 4 years from the time that they first had sex to the time that they first talked to a healthcare provider about the fact that they had male sex partners. So just moving sort of into the implications briefly, we sort of touched base on some of the implications as we've been going through the survey findings. And really I think just to go back again to the comment I made initially, that this is really just telling us about the current trends in infections, prevalence, and behavior. And so we have to be careful in terms of thinking about strategies that are based solely on this data when we think about all the other factors that can influence HIV transmission and gay men's health in general. But certainly, the findings do speak to the fact that this is critical. HIV is clearly an important health issue for us in our community, but at the same time it's also chronic, which is sad to say, but in the sense that we are continuing to see sustained constant numbers of new diagnoses every year, and the HIV is prevalent in our community and will be here for a long time to come. The other point is that this is not unique. So many of the findings, as I mentioned, that we found here are similar to what's been reported in other major urban cities. I'm sure there are definitely differences between other areas. I know, just thinking back to some of the data that came from the MTRAC study in Victoria, that we do have some differences in Vancouver compared to Victoria. But I think the other implication is that there really isn't one single factor that's responsible for HIV, and there's multiple drivers of the HIV epidemic, ranging from, at the most basic level, the prevalence itself. With 1 in 5 men having HIV, the likelihood of having a sex partner who has HIV is high, obviously, compared to other populations. And other drivers like sexually transmitted infections or behaviors that are contributing to HIV. I think the other take-home message for us is that prevention is clearly important to gay men, but that the strategies that are used may not always be effective. And I think that's been clearly demonstrated by our data. And clearly, gay men are also getting tested, and testing is definitely high, although there are gaps, in particular testing for other sexually transmitted infections or testing by younger men. And really that there may be an opportunity to reverse some of these trends within young men in particular. So just end, part of our original vision around the survey was to inform our collective action, and so we're really kind of at that point right now where we're beginning to think about what are some of the actions that we would take, or some of the strategies we might consider based on these survey findings and in consideration of all the other information we know about gay men's health and HIV prevention in British Columbia. And certainly I think what's also emerged from initial discussions is that many agencies, not just in Vancouver but around BC, are already doing very strong and solid efforts for HIV prevention and effective efforts for HIV prevention, and these certainly need to be sustained, but we do need to strengthen our response to HIV prevention if we're hoping to change these trends. Similarly, as mentioned, that there probably isn't like one or two main strategies that we should be landing on as a result of this survey data, that really multiple strategies are required to act at multiple levels really to have an impact on HIV. But as I mentioned, we are just beginning to do our planning collaboratively, and certainly welcome a dialogue today around what some of those strategies might be.